and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗛𝗏𝗵𝗹 as we discuss the latest health and medical topics with doctors from 𝗛𝗏𝗵𝗹. For a healthier and uplifting lifestyle, tune into Healthline with 𝗛𝗏𝗵𝗹 on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗛𝗏𝗵𝗹, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗛𝗏𝗵𝗹 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗛𝗏𝗵𝗹. My name is Nicole Jacinto. I'm your host for this show. And today we have with us Dr. 𝗛𝗲𝗵𝗹𝗶. Hi, Dr. Lads.
Hi,
I
Nicole.
hope you don't mind if I call you that, if I call you Dr. Lads on the air.
Sure,
Oh.
sure.
Yes, just to let the viewers or remind them, the audience, that I've met you before on the air and I've met you in person, and you're a great doctor because I took a patient to you. And
Thank you.
of course, you're a nephrology specialist, and today we're going to discuss chronic kidney disease. But before we do that, doctor, I'd like to greet my father a very happy birthday. I saw you last night, Dad, but happy birthday anyway, Ramon Jacinto. Thank you for giving me your face. Just inherited it. I look like you, Dad, so that must mean a good thing. It means you're guapo, Dad. Okay, well, anyway, parang baliktad, no, doctor? Siya pa yung guapo.
Happy birthday, Ms. Jacinto.
Okay, Dad. All right. Thank you, Dr. Peñaranda. Okay, so, Dr. Lads, we're going to talk about chronic kidney disease today. Let's start off. What exactly is chronic kidney disease?
Okay, when you talk about chronic kidney disease, it means that the process is starting initially as a kidney injury, and then it becomes irreversible. And it is usually manifested as first, when you have a urinalysis, and then you find something there in the urine, like, for example, protein, lots of RBC, and casts. So when you find those things, you really have to see you have to see a doctor, specifically a nephrologist, because when you say CKD or chronic kidney disease, it means that there is an irreversible damage already to the kidneys by an EGFR. We call it the kidney function EGFR. No, it should be like 60 and below, because when you have a GFR which is already low, the normal of which is 90 to 120 for ages 90. For ages 30 and below, the normal GFR is 90 to 120. Now, we must remember that each one of us, lahat tayo, when we reach the age of 31 onwards, our kidney function will not be the same anymore. Of course, our kidneys will also age. And 1 year after 30 years old and onwards, you will have a diminishing kidney function by 1% per year. So, for example,
your doctor.
Yes, correct. So when you are 90 years old, of course, your kidney function will always be low, because it will what you call this? It will just be a proportion to your age level. So the exact definition of CKD is when you have an albumin in the urine of more than 300 milligrams of protein.
Of protein, okay.
Protein. And then, number 2, pag ang kidney function mo or eGFR mo is less than 60 na for
Yes.
3 or 4 months. Yun.
Okay, for
Pwede 3 or
Okay.
4 months. Yeah.
All right, doctor. So perhaps we can you defined exactly what chronic kidney disease is, and you said it starts with an injury to the kidney. Perhaps we can circle back to how, because since you defined it, perhaps we can circle back to that again in a few minutes and repeat
Sure.
that when we talk about how exactly diagnose it. But basically, you said it already, because like some people might say, "Oh, I have my kidneys are not doing well right now," but
Mm-mm.
you have outlined something for us already in the sense of how to diagnose it. And
Mhm.
basically it's like, one, it could be, let's say for a certain reason and you're hospitalized and there's other factors. If
Mm-mm.
your kidneys don't look so good from the urinalysis and whatever it is, it might not be chronic kidney disease right away. It would have
Correct.
someone
Correct.
like who could diagnose it, because as you said, it's in a period of 3 months or more.
Performance.
Okay, so
Yes.
when you say injury to the kidney, doctor, what
Mm-mm.
exactly do you mean by injury? Like, what is a typical type of injury that could start chronic kidney disease?
Okay. When you say the initial injury to the kidney may result, no, in a variety of clinical manifestations. It range from asymptomatic hematuria, meaning wala kang naramdaman, no? But on your analysis, meron kang red blood cell doon,
Okay.
to
Yeah.
kidney failure requiring dialysis. So, yun ang injury, I mean, the worst scenario that could happen, no, to injury to the kidneys. No? Some individuals also may fully recover.
Yes.
Sinabi niyo, as you've said nga, Nicole, sa mga hospital, doesn't mean na may CKD na kaagad, no? They may have what we call as acute lang,
Acute.
kidney injury, meaning reversible.
Reversible. Okay.
For as long as you eliminate the cause and you treat the cause, ang kidney function will just follow.
Okay,
Will just follow. So,
Doc-
yeah.
Sorry, go ahead. Go ahead, doctor. I didn't mean to interrupt you.
Some patients, halimbawa, may lupus sila, no? May lupus, no? Paulit-ulit yan. They have repeated and chronic insults to the kidney, and it will cause permanent damage to the kidney. Okay. Others naman, in the initial disease nila, which is either inactive or cured na, it may still develop progressive kidney disease due to some other factors like, halimbawa, may cardiac problems, nag-heart failure sila, and other things. No?
Yes, doctor. Thank you, doctor. And in medical terms, just to remind the audience, when the doctor says an insult, it's basically an injury. Like if it's an insult to brain, hindi na sinabi na bobo ka, hindi ganon. Or sinabi sa kidney, alam mo, pangit ka. Basically, the injury yun. Like it's either like natamaan or something.
Yes.
Diba? So, konting lang, doctor. We know these are heavy issues, but so, just a little bit of parang putting it also in perspective, because when people go to doctors like you can, the thing is to face it sometimes is difficult, no?
Correct.
But I'm reminding and inviting the audience out there that this is a platform for you and Makati Med to explain, to promote good kidney health, to explain what it is to have chronic kidney injury, or chronic kidney disease, or CKD. Sometimes when you see CKD, I think of like, sounds like a pizza or some kind of chicken. Okay. But it's always best to hear the doctor say it. And thank you again for your time and for being here. I know how busy you are as a doctor, and when I see you, you really do make time for questions and your patients, and questions of those who accompany your patients like myself. So today is no different, doctor. Okay, so you've outlined, basically, you've told us that just because something happened to your kidney, or it shows that it's injured, or there's an acute injury at one time, it doesn't mean you automatically have it. You've spoken of some of the causes and some of the ways to diagnose it or to make sure that it is chronic kidney disease. Can you tell us first, doctor, though, what are the common symptoms of of somebody who has CKD?
Okay. Usually, when we talk of CKD, may stages yan. We have
Ages.
stage 1,
Mhm.
2, 3, 4, 5. The worst, of course, is stage 5. No? Pag
Yeesh.
stage 5 na yan, meaning, yun na, the symptoms become apparent already.
So,
Like
pwede
in the
stage 1 pero
form.
hindi mo alam.
Stage 1, normal pa.
Normal.
Stage 2, medyo okay pa, no? Because your kidney function should be like 61 to 90.
Okay.
Ano? Oo. And as I've said, it depends on the age of the individual,
Yes,
no?
yes, yes.
Pag CKD stage 3 na, it's 31 to 60, no?
Mm.
Pag CKD stage 4 na, it's 16 to 30 na siya. And then 15 and below 5 na. Now, the patient who has stage 5 CKD will soon develop na generalized body weakness, nanghihina. Oo. Nawawalan ganang kumain.
Okay.
Tapos, nasusuka lang palagi. Pagkatapos, minsan nagka-cramps ang kanilang mga paa. And also, sometimes, no, they develop abnormal sleeping pattern, no? But what is really visible is they manifest as pallor, no? Pale compared, pale. And then if the kidney disease is so severe already, meaning the creatinine, the BUN is so high, they could manifest already as having a rapid breathing. Nagiging acidotic na sila.
Okay.
Rapid breathing na feeling mo hindi na siya makahinga. But actually it's because more of the acidosis. And
Okay.
so yun.
All right. Okay. So those are the common symptoms. And as you said, please jump in and correct me anytime if I'm wrong. Many of these parang more obvious symptoms manifest when it's in a later stage.
Correct.
Okay. So pwedeng may stage 1 ka but you're not aware because you know, you didn't realize that there was an injury or insult to your kidney. Okay, then and then you thought, oh, okay, it's okay. And then you're also talking about the age. So I guess okay, what are okay, we've touched a little bit on diagnosis. So let's go there. It's important, I think, that you emphasize the age always because like people like me would freak out before, oh my God, the kidney function is so low. Remember when I went to you like that? About somebody else, and then you were explaining that it has to do also with the age. Does it have anything to do with the gender? You already explained the kidney functions. As you said, the minute we turn 31, we lose about 1%
Yes.
a year. So if somebody is 90 years old, then we shouldn't be so freaked out na, oh my God,
na 40 na lang or 35 na lang yung kidney function, creatinine niya 1.2 because it's expected of your age group na ganun.
Just like gray hair is expected or something like that.
Yes.
Yeah. I think I'm getting that from stress though, not from my age. Nuts. Just kidding. Okay. So, all right. So when it comes to the causes you've mentioned, one is just an initial insult or injury to the kidney, then it starts there. Or like maybe, you know, continued insults or injuries to the kidney. People don't realize are happening. You mentioned the common symptoms, and like the more obvious ones come at a later stage where there's acidosis, parang they have rapid breathing, tas nanghihina, walang gana in disturbed sleeping patterns. Parang ako yun, pero I hope I don't have parang ako yun lately, baka stress lang yun.
No, don't say that.
Yeah, no, I don't have it. I don't have it, knock on wood. I'm just worried about the people who have it. Can I also ask you if it's inherited? If it is inherited or if it is environmental when it comes to the cause of CKD? Because I met a young, well, actually I didn't meet her. I just had the opportunity before to my mother actually helped this young woman. She was 26 and she had CKD. And then both her parents had it, and they passed away from it. And then like a couple of years later, because my mom was helping her with the dialysis, She also unfortunately passed away and she was so young. So I'd like to ask you if it has anything to do with genetics or is it environment? Because even if it's familial, like baka they live in the same house, they have the same habits. Like, are there certain causes to it that we can pinpoint to?
Well, number one, no, the most common usually pag inherited is when you say adult polycystic kidney disease, no. When you
Okay.
say adult polycystic kidney disease, no, it is common in a family wherein they develop cysts, no, cysts at a young age, and then becomes very big to the
Okay.
point that that cyst destroys the function of the kidney. That's number one, inherent, no. But of course, no, in the Philippines, no, the most common cause is number one, uncontrolled hypertension and diabetes. Those are the two most common causes of CKD, no, which sometimes, no, if you're not going to look seriously on it, it will develop into a complication. No?
Yeah, like if you just let it go, because I'm young pa, I
Mm,
can control my blood pressure
mhm.
on, or
Yes.
never mind if my sugar's high, ano, parang you don't really attend to it.
Yes, that's true.
Okay, don't
Oo.
attend to it and follow up on your kidney
Mm.
health.
Tapos when you are young, halimbawa in your adolescent stage, no, there might be some instances wherein you develop tea-colored urine, no? Not dehydration, no, but tea-colored, and then you develop some rashes, tea-colored urine, and then the BP went up, no? So that's something to look to be examined, no? You don't just have to, I mean, you don't have to be complacent na, oh, it's just an ordinary thing like that, because later on, it will already cause kidney damage, irreversible damage like that. That is what they call as chronic glomerulonephritis, yung namamaga, no? It's an autoimmune disease wherein the normal cells usually destroy its own cells, no? Resulting to deposition of tawag natin yung product nila sa kidneys, and then the filtration system is damaged.
So, doctor, those who may be at higher risk for kidneys, without talking about lifestyle first, no, general, are those who may have manifested something earlier on. As you said, if an adolescent suddenly has nephritis, which is the swelling of the kidneys, or and then they have high blood pressure for some reason, but able to control it, that could be like
Yes.
that could be the first insult to the kidney.
Correct.
First insult or the first injury to the kidney that starts causing it, and later on it will manifest 31 and upwards. And then you did mention cysts, doctor, and I'd like you just to I'd like to hone in on the issue of cysts a bit, because many many people are told they have cysts in their kidneys.
Correct.
I know, or I don't know from talking to you, if we have cysts in our kidneys, that's also something that starts happening when we're in 40 and above, right, doctor? Or in our 30s?
It could be earlier, but you know, cysts sometimes are incidental findings, meaning you do not intend to look for a cyst, but for example, you develop abdominal pain, and then your doctor requests for an ultrasound, and then incidental finding, you have a cyst. So it could have been there a long time ago already, but you know, it grows very, very slowly, and there is no medicine for that. No, those are called simple cysts. No, there's no medicine for that. There's no surgery, but the doctor will just tell you if it gets, you know, I mean, it's big on initial finding. If it's big, then you must undergo usually a CT scan to check if it's malignant or not. No, but generally those cysts which are small are just benign, simple cysts. No, nothing to worry.
Doctor, okay, let's say someone had a CT scan because let's say their back hurt, and they
Yes.
thought it was like, you know, maybe they had a they've gone to their general practitioner doctor and their back was hurting all the time, and then they, as you said, it could be an incidental finding, so they might think, oh, maybe this person has a slip disc or something like that, right? Because the lower back
Yes.
all the time. And then let's say they've gone through the CT scan and then it comes out and then, okay, you have cysts, but it's not anything to worry about because
Mhm.
they're not big.
Benign lang.
Yeah, they're benign. So
Mm.
then you don't have to panic, but it's something you should keep in mind for the future.
Yes, lalo na more so if you have history of cancer in the family, for all you know, that cyst will transform into something else in the future. So it needs monitoring also.
And doctor, those cysts, when we're told that, at this stage it's okay because some people might ask, well, why don't I just remove the cysts already? But, right? All of them, just
Yes,
take them out now. But I've been told, not by you, but by someone else, that if you take out those cysts now, like basically the treatment for that would be to sort of inject them with alcohol, but there's no,
correct.
you won't go back. So parang
Mm-mm.
you're killing the. So what would you recommend if somebody came to you? You can make up the age and whatever, like, but look, let's say a female in her 40s or something, and
Mhm.
said, I have cysts, or, I have a
Mm-mm.
history of cysts. Should I remove it? Would you, and benign, what would you say to that?
Zeroing in on that. Just today, I have a patient who came in because there was an incidental finding of a cyst of her right kidney, and it's so big. It's 7.4 centimeters. That's big. But, she doesn't feel anything. The problem is it gets bigger and then it will compromise the kidney function. And then it becomes infected, then that's the trouble. So, if you are symptomatic, for example, because of that cyst, now, basically don't really have to open up the patient. No, we have good interventional radiologists right now. They what they do is through CT scan guidance. No, they puncture a needle, the skin, and then in real time go straight to the cyst, and then they aspirate the fluid. No, after they aspirate the fluid, they inject alcohol to sclerose, meaning to make to burn it, no, such that there will be no blood vessel anymore. So there will be no room for the reappearance of that cyst because the blood vessel has been totally uh, removed. I mean, yes, burned. Yeah. So that's one of the procedure for big cysts who are symptomatic. No? And of course, that is not a bed of roses. Infection might set in also in those procedures. But of course, with a skilled interventional radiologist who does it all the time, I'm sure it will be there will be a good outcome.
Okay, thank you, doctor. And that's just to talk about cysts. And apparently, you had a patient today. So, I mean, usually, if it looks like if it's benign cyst and something, you can say it's okay, leave it alone. But if there's
Yes.
something abnormal about it, and then you take care of it. And as you said, you have good interventional radiologists now, and it's an
Mm-mm.
outpatient thing. And when we say alcohol to burn it, we're talking about like alcohol to use in the hospitals or to disinfect ourselves. That kind of it's a special formulation.
It's special, yes.
And let's not go around injecting ourselves with scotch in our kidneys or something. Okay. All right.
Okay.
So, okay. So there for the cysts, because some people have been told they have cysts, so they might freak out. Oh my God, I might have
Mm-mm.
CKD. No, not yet. You must
Mm-mm.
go to someone like Dr. 𝗛𝗲𝗹𝗁 to find out if you really do have chronic kidney disease. Okay, so doctor, when it comes to diagnosis, like how exactly, let's say I walked into your office and I said, I think I have chronic kidney disease because I have some of the symptoms, like I can't sleep at night, I'm throwing up,
Mm.
but sometimes I find it hard to breathe. What diagnosis?
Approach. How
Yes,
the approach?
and how would you like
Mhm.
diagnose me?
Mhm.
Like,
Yes, of course.
Mhm.
Mm-mm. First and foremost, you have to dig up on the history. You have to ask if there's any history of high blood pressure, diabetes, long-standing diabetes. You must remember, diabetics, no, who are 10 years, no, already on the disease and upwards, no, 10 years or more, regardless of their age, regardless of their level of serum creatinine, regardless of their weight, no, and then other things, no, they are already labeled as having diabetic kidney disease, meaning, no, they are already entering into a complication of diabetes, which is diabetic kidney disease, no. So when a patient comes to you, may panicking, may asking you if you have CKD, we must dig into the history, high blood pressure, diabetes, and of course, we must not forget history of heart problem. Because if the patient has an undiagnosed heart problem, it will also manifest, no, as an increase in the serum creatinine of the patient, meaning that is what we call now as the cardiorenal syndrome.
Cardio.
The heart being the major organ also, which supplies 20% now of the output to the kidneys. So you can just imagine, if it's 20%, it's a big supply, of blood to the kidneys. So if your heart is not able to function normally, definitely it also have an effect on the supply of blood to the kidneys. And sooner or later, the kidneys will also manifest as having a abnormal kidney function, because these are two brothers and sisters. So there is a bi-directional relationship between the two. The same is true. If you have kidney disease, sooner or later, the heart will also manifest.
And if you have and basically, from what I understand of what you just told me, if you have some type of heart disease, sooner or later, it can manifest or will manifest in your kidneys.
Yes, correct.
So basically, doctor, those who are at higher risk for getting kidney disease are those who maybe like have
High blood pressure,
diabetes, more than 10 years.
yes, uncontrolled hypertension, diabetes, cardiac disease, those which has genetic or heredofamilial disease like adult polycystic kidney disease, or those who have secondary types of glomerulonephritis like lupus.
Yes, those who are immunocompromised with lupus.
Those who have multiple myeloma, and sometimes those which are on chronic chemotherapy.
Okay.
Soon, their kidneys also become affected by those specific chemotherapeutic agents, no? Kasi not all of those chemotherapeutic agents will injure the kidneys. There are only selected chemotherapeutic agents, no, which they use, which would harm the kidneys. But of course, it is for the kidney doctor, no, to prepare the patient well if they encounter such patients with that presentation.
So, doctor, the first thing is your line of questioning, like you're a detective or a lawyer with your patient, right? Because let's say somebody came to you, oh my God, doctor, a few years ago I discovered I have cysts. Now I'm throwing up and I can't sleep well and I have all these other symptoms and I'm not sure and my back hurts and all of this stuff. So you will interview them first and find out, okay, do you have high blood pressure? Are you on medication? Do you have a heart condition or heart
disease? Heart problem. Yes.
And it could also be or do you happen to be diabetic, and have you been diabetic for 10 years? And it doesn't matter what type of diabetes, it's either that it can be type 2,
usually type 2.
So it's something that you develop when you're an adult, right? Because you have too much sugar. Okay, too much sugar in your blood. So it could turn out that this patient who comes to you panicking, you're like, it could turn out you say, oh, I don't find anything because you don't have high blood pressure, you don't have this, you don't have that. And then you check you take a blood test, no?
Yes, the blood test.
And then you could even ultrasound the kidneys if you want, or do a CT scan. Of course, using all the technology in Makati Med, then you find out your kidneys seem to be clear. So when it's something like that, the patient should really check with you and then also give you the truth about their background. Like, I'm not on I'm not on maintenance, or I don't want to take
Especially,
maintenance because I'm only 40 years old. I refuse. Diba?
especially those also who are taking, I must remind our listeners, no, they should be very careful about herbal medicines also. You know, I mean, those uh, what to call this, all the things that you see on social media, that this, you know, this, not medicine, although this concoction or this something like this product will improve your kidneys, this product will do like this, like that. No, you should be very careful about those things. No, they should be regulated by the Food and Drug Administration. So let's remember that. And also, of course, you must not forget about those who are building their muscles in the gym.
Uh-huh.
Those who are taking too much whey protein and creatinine to bulk up. But at first, no, they will not notice, no, the effect of those whey proteins and creatines that they are taking. Of course, they have a good body, they have, they're bulked up, no, buffed. But in the end,
I'm not like that. Okay. So gym for me and buffing up. Okay. And then, but
in the end, it will make your kidneys overwork, because those whey proteins and creatinines are considered as high protein. No, high protein, you must remember, makes the kidneys overwork or hyperfiltrating. No, so and imagine any machine, anything for that matter, which overworks soon will have its effect. No,
yes.
it will get destroyed also. Even machines, yeah.
Even machines get destroyed, and so it can happen like that. I mean, I'm glad you mentioned it, because there are people who like really work out when they're younger, and they take supplements where they want to build bulk and their muscles.
Yes. Oh, yes. Oh.
So,
they must regulate it. They must regulate them.
and the supplements aren't, yes, they're approved by the FDA, but you have to remember they're supplements. So if you're already having some problems with your kidney,
Yes, correct.
your heart doctor, even your neuro doctor, diba, doctor?
I suggest that those who are taking too much whey and supplements, no, for buffing up, they must check their kidney function regularly, because when they find out it's already going up, the creatinine, they should stop.
Okay.
Or else they will end up with having chronic kidney disease also.
All right. Doctor, we just have to take a short break, and when we get back, we'll talk more about how you said it's irreversible, but we'll talk more about that later, and things that can be done, because you said if the cause is removed, then that might be able to stop the illness. And certainly more information from you, like, you think you're being healthier by buffing up and doing all these things, and of course looking good also, and feeling good makes you feel good, but you don't realize that not every product out there does what it claims to do. Okay, doctor, and we'll talk more about medication and how it can affect kidneys also, considering all the different conditions that can affect your kidneys. So, doctor, we're just going to take a break. Audience, we're going to take a short break. We'll be right back with more here on Healthline with Makati Med. It's Dr. Miguel Eladio-Peñaranda, or Dr. Lads. He's a good doctor. So we'll get more information from him in just a couple of minutes. Stay tuned.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Gia Season from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City. Hi, this is Dr. 𝗛𝗶𝘁𝗵 and welcome to Makati Med Wellness Center. Located at Ayala North Exchange, the Makati Med Wellness Center is a warm and comfortable state-of-the-art lifestyle center where executive checkups and services that address holistic patient care and wellness can be done. We have a skin and laser hub, diagnostic imaging, health screening, mind and wellness care, and physical medicine and rehabilitation. The Wellness Center is equipped with modern facilities and staffed with competent healthcare professionals who are committed to deliver premium, personalized, and easy access healthcare services for both adult and pediatric patients alike. This is a great place to prioritize your health and well-being without having to be at the hospital setting. We are open from Monday to Saturday at 7 a.m. to 5 p.m. at the 7th floor of Ayala North Exchange, Tower 1 in Makati City. It is also accessible from the Makati Med Hospital through a bridgeway to Ayala North Exchange. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Wellness Center.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Hi, everybody, and welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. Today we are with Dr. 𝗛𝗲𝗵𝗹𝗁 or Dr. Lads, as I might call him on the air. I hope you don't mind again. Bit of informality here, but we have met in person a couple of times, and I'm always bugging you with questions, so this is no different, doctor. But thank you for sharing your time and giving us your effort and knowledge, sharing the knowledge with the audience about chronic kidney disease. Okay, doctor, picking up from where we left off, just to sort of recap, you said having high blood pressure, hypertension, and also diabetes are two things that are risk factors for anyone of any age to develop chronic kidney disease. If you said if you have diabetes 10 years or more, meaning and usually type 2 diabetes, so your sugar in your blood is not controlled, no? Like whether you're on medication or not for it, oral medication or whatever it is, injections, like it's not being controlled, you are already at risk for that. Also, doctor, with high blood pressure, can we tell the audience, like, you did say that 20% of the blood, if you have something going on with your heart, 20% of the blood that goes to the kidneys comes from the heart. So there will be some form of damage, or maybe the circulation is not good enough. But can you explain also, doctor, to the audience how the kidneys actually help the heart when it comes to maintaining blood pressure?
Okay, because there are a lot of hormones which are present also. No. Because we must remember that the kidneys have, on top of it, are two adrenal glands, no, which are responsible for controlling the sodium and the water. Those
So,
are two very important things. So because if there is an abnormal regulation of salt and water in your body, you will develop hypertension, high blood pressure. So if you develop hypertension or high blood pressure, of course, it will give a toll on your heart. Now, your heart will get big. Your
mhm.
heart will suffer, like in the form of cardiomyopathy if the blood pressure is really high and not controlled. No, so the kidneys are a very important organ to regulate water and salt in the body, as well as the hemoglobin in our body, the red blood cell.
Red blood
Because
cells.
yeah,
Okay.
the hormone also erythropoietin is found in the kidneys, and also our calcium, our phosphorus, and bone metabolism. These are all found in the kidneys also, no?
So that's so important. It's
Yes.
not just like, okay, it's there to make you pee pee out. And so it's really all interrelated.
Yes.
And I just wanted the audience to kind of get that it's all interrelated. The kidneys are important in maintaining all of these things. They
Mm-mm.
work with your heart and as you said, the two
Um,
adrenal glands to really make sure that your body it's important in
Usually,
maintaining the
yeah,
salt, sodium, and the
water, sodium, and
hydration.
water regulation. And
Yes,
of course, there must be a check and balance to maintain what we call as homeostasis. No, homeostasis meaning there is a balance of everything in terms of your electrolytes, in terms of your
yes.
filtration. Filtration. The kidneys, the main purpose of the kidney is to eliminate those which are not needed by the body. You know, those which are needed by the body are being reabsorbed by the kidneys. No, oh, that's very important.
Doctor, what are the treatments that are available for CKD? I mean,
Okay. So when you say maybe the general management, no,
yes.
of the patient with CKD, of course it will involve the following issues. Number one, the treatment of the reversible causes of kidney failure. No?
Treatment of
When you,
reversible.
or when you say reversible, meaning, if, for example, you have what you call this, um, acute kidney injury, which is reversible, no. Well, of course, the literature would tell us that if you have acute kidney injury, your chance of developing CKD or chronic kidney disease in the future is great, no. Treatment of reversible causes should be like high blood pressure, controlled,
Control.
diabetes, controlled also, no? We prevent also or slow the progression of kidney disease. How? Of course, by diet. If you
Diet.
have CKD, you avoid high protein food. Oo. You prevent it also by not taking NSAIDs, those medicines which would cure pain. Oo.
Non-steroidal anti-inflammatory drug.
Correct, correct.
The
You
over
avoid
the
that.
counter that people are so fond of. Oh, my back hurts. I'm gonna take.
Oo.
I might mention
Yes,
something. Never
yes.
mind. Dynamic acid or something like that. I'm trying to remember
Mm,
all the. Well, it just come to me the generic
mm,
stuff. Was-
mm,
So so there's an
mm.
interplay between diet and medication.
Medications also, and the treatment of the complications, no, of kidney failure, complications like, for example, um, well, most common is hypertension, no. Those are the complications of kidney failure. No, adjusting drug doses also. No, when you have CKD, the doses should be adjusted. It should not be the same as those without chronic kidney disease. No, and then of course the last issue here in chronic kidney disease is the identification
Mhm.
and adequate preparation, of the patient in whom kidney replacement therapy will be required. When you say kidney replacement therapy, it already includes peritoneal dialysis, hemodialysis, and kidney transplant.
Okay, doctor, let's go to kidney transplants because, okay, so
Mm-mm.
as you said, there's dialysis also, which a lot of people are on. Now,
Mm-mm.
if you do a transplant, if there's a kidney transplant, the patient can do a kidney transplant and they get a new kidney, can that
Mm-mm.
in effect sort of cure CKD?
Oh, yes. It can cure CKD, but you are already labeled also as having CKD
Mhm.
because of your kidney transplant, no?
Yes.
You are labeled, but that is already according to nomenclature lang yan, no? But of course, the best really is kidney transplant because it's just having a new kidney,
Mhm.
no? A new kidney which would make you feel younger, good skin again, and everything. You go back to you where you were before, no, before you develop CKD. That's
Okay.
the best renal replacement therapy. Mm-mm.
Okay. And I understand,
But
doc.
I'm sorry, Nicole,
Go
sorry
ahead.
to interrupt you. But not all patients with CKD are eligible
Yes.
for kidney transplant.
Who
There
are
are, mm-mm,
eligible, doctor? Let's talk about
yeah,
the ones who aren't eligible for kidney transplants.
those who are not eligible, of course, those who are having psychological problems, no, they cannot drink their medicines on time. They they have emotional instability. No,
Mhm.
it will affect no their kidney transplant in the future. Those who are already very old, like 75 years old and above, because to start with, if you reach the age of 65 onwards or higher, our immune system is generally low already. And you must remember, if you go into kidney transplants, you are bombarded with a lot of immunosuppression. That is to avoid rejection. So you are bombarded with a lot of medicines to lower down your immune system para ka may HIV or AIDS. Ang
Yes.
baba-baba ng immune system mo. So more sometimes no, we do not recommend anymore for those
Mhm.
individuals who are already very old.
Mhm.
And of course, those who have cancer.
Mhm.
It is cancer which is irreparable already, no? Because we must remember also that the medicines in kidney transplant could also proliferate cancer, or even with a patient who is in remission, they
Mhm.
go into transplantation. Well, most of them, not most of them, but the chances are there, no, that their cancer will be active again.
Okay. So, doctor, for those who would say, why not just get the kidney transplant right away? When we're talking about eligibility for it, there are some factors because, as you said, when you get a kidney transplant, you have to get immunosuppressant so that your body doesn't reject the kidney itself.
Correct, the donor
It's a foreign
kidney.
object because of
Mm,
that's how our immune system works. If it thinks it's a
mm,
foreign object and it's there,
foreign.
it will start rejecting it. But the
Mm,
thing is, if you give some people those immunosuppressants, their immunity will go down and
yes, definitely.
other things. So it might cause them more complications.
Mm-mm.
Um, when you talk about age, I mean, what if somebody still can receive it, even if they're 75 or above? What if you figure out, okay, this person can take a kidney transplant? Do you do it? If
The
it's a
important thing is the consent, no?
consent, yes.
It should be clear between the patient and the doctor, no? The
Mhm.
doctor may explain full well, no, the consequences, no, of having a kidney transplant. Because if the patient is already on dialysis, there is
Mhm.
not much difference in the lifespan of a patient who is on dialysis versus those who will have kidney transplant. The same lang in lifespan nila.
Mhm.
And kids kidney transplant sometimes, no, in an elderly individual could even shorten because of the complication of infection. The infection will be the one to put them down.
So,
Mm-mm.
doctor, basically, that's where you come in with the management for CKD as opposed
Mm.
to doing the transplant.
Yes.
As you said, there are people who may have or have had cancer before, but again, if you bombard their bodies with immunosuppressants, then
It may be active.
yes, and
It can
you
be
did
active
mention
again.
earlier that those with like you said chronic sorry, maybe you can help me with this. You said chronic chemotherapy.
Chemotherapeutic agents.
If they're receiving chemotherapy, then they get a transplant. The chemotherapy already lowers their immunity in order to cure something, right? Because essentially it's like poisoning the tumor or whatever it is, but the rest of the body
Yes.
also kind of feels the poison. So it would be like double. I mean,
Uh-uh.
in terms of the pressure it would put on a patient's body to recover. Okay.
But I just want to clarify, no,
Yes,
it
yes.
doesn't mean that if you have cancer, no, you cannot be transplanted anymore. Of course, it depends on the stage.
Depends on the stage.
If it's stage 1 and that the patient is already cancer-free, then you can do kidney transplant.
Okay. And then, okay, so doctor, you mentioned diet. Would you suggest people who have chronic kidney disease see a clinical dietitian?
Oh, yes, that's very important.
Yes, because we often don't know. Like you mentioned earlier, there are people who take too much whey protein to build up, or they're fond of eating protein. And there were those diets before where like don't eat rice or any kind of carbo, just eat meat and then you'll get thin. And then you'll have
Keto diet.
keto diet, or what do you call that? That guy, oh, I forgot. I can't believe I forgot his name again. But in the 90s, it was all the rage. Like you eat protein, then you can eat a whole plate of bacon as long as you don't eat rice or other carbos.
Sa everything in moderation.
Yes.
Moderation lang.
So you see, we have this false sense of it. It gets tricky, no, when it comes to diet, because people will say, "Ay, bawasan ko yung kanin ko," or "I'll take out my rice because rice has gotten a bad reputation over the last couple of decades," right? And as Filipinos, we eat a lot of rice.
But Nicole, there's a substitute. I mean, if you really love rice, you can. There is one type of rice which is the lowest glycemic index, 𝗛𝗲𝗓 rice.
𝗛𝗲𝗓, okay, there.
𝗛𝗲𝗓 rice. It says they can search it in Google. No? It will tell you that it has the lowest glycemic index.
Yes, and apparently, doctor,
ADLAI, 𝗛𝗲𝗓.
ADL, okay. AI, okay. And then doctor, apparently, like, is it okay? True. Give us the answer, Mythbuster, whatever. Like, a lot of people eat brown rice to be healthier. Then there's black rice also. It's like, there's black rice. Okay. So there's black rice. Okay, then there's red rice. I'm not against it. I've eaten them before, but is it true that white rice is actually better for your kidneys than the other?
No.
No. So
it's all about the sugar.
It's all about
carbohydrate.
Okay, but let's say someone is on the borderline of high sugar, or they don't have high sugar. It would be better for them to take some carbohydrates rather than more protein when it comes to kidney health.
Not really more protein, but yeah.
Less protein, more carbo is okay.
Basta low protein lang.
Low protein, okay.
All four-legged animals are considered high protein.
Okay, and what about two?
Low protein. Chicken, birds. Fish, low protein.
What if you're allergic?
Allergic, maybe you can go veggie. Vegan.
Okay. Therefore, the clinical diet, that's where the clinical dietitian comes in also.
Yes.
Okay. Doctor, I'm going to ask you for the name of a clinical dietitian, actually. Just text you.
I will text it to you.
Okay. So, there. I mean, it is important. I was reading up on nutrition, and I'm not a very, basically, I don't really eat healthy. My mother does, and she has eaten healthy a lot, but sometimes you just really have to it's a holistic thing, isn't it, doctor? Like, also, if you have CKD, do you sometimes recommend your patients to see a psychiatrist or a therapist so they can discuss it? Because the more stress they feel,
better they talk na lang to a nephrologist, not naman really psychiatrist.
Okay. Syempre, then the cycle will go back to your
So
nephrologist.
the key lang to a healthy kidney to prevent CKDs, of course, you must stop smoking, stop drinking alcoholic beverages, be physically fit and active. If you have high blood pressure, you must control your blood pressure. If you have diabetes, control your diabetes. Avoid drugs which would further injure the kidneys.
Okay, doctor, one last question. I think we're running out of time, but the interplay of medicine, you did mention supplements, and that you know, they don't always do what they claim to do, right? You reminded us to be careful of that. But okay, heart medicine, can you give us, like, if somebody is taking medication for high blood pressure, what are the safest types of heart medication to take for those who have kidney issues? Like, I mean, there are like 4 types of blood pressure medicines, I think, and there's one. Are ACE inhibitors safe?
Yes. ACE inhibitors, ARBs, so what they call as angiotensin receptor blockers, are all good for the heart and the kidneys.
Okay. Because there's been some like debate about that, no?
They're good. They're good for the kidneys.
How about diuretics? No.
Diuretics, if you have edema, if you have water retention, then
If not, then
no.
So you must also go to your nephrologist and ask what medicines do not
Correct.
hurt kidneys, and also
Yes.
cardiologist or internist, and it works together.
Correct.
Okay. Anyway, doctor, what advice? I'm told we are running out of time. Oh my gosh, yes, it went by so fast. Though I'm gonna visit you and just like keep you there for 3 hours. Doctor, and then I have an update for your patient. So anyway, like, okay, do you have any final words, doctor? Any advice to people who think they have CKD or those who have it, you know, and they're struggling with it?
Those who have CKD, if you think you have some kidney problems, don't be shy, don't be afraid. You consult your kidney doctor, because in the end, they'll be the one to help you.
Okay. Thank you, doctor. Thank you so much. And also, when somebody says you should see a nephrologist, go see one. All right. Okay, I'll postpone it. Okay. Thank you so much, doctor. I
You're
will
always welcome, Nicole. Basta
see
ikaw
you.
anytime.
I'm gonna hold you to that. Ikaw, doc. Hindi naman. I'll bring you patients. And
Hindi naman.
you know naman the patient, dinala ko na sa'yo. So anyway, thank you, doctor. I would really also like to thank, you know, God and the universe for giving me this opportunity to deal with people like you. And then I meet you. And then you also come highly recommended, not just on the air, but from other doctors.
Hindi naman.
Yeah, you do. I'll tell you later. Na it's something I really hope the information gets to the people that it needs to get to, that awareness is raised, that questions are answered. And even though it can be really complex to take care of yourself or someone else at other times, the doctors are there to help you, certainly doctors like you. And if you don't like your doctor, get someone else. I mean,
trust. There must be the trust.
And then, like, doctors like you will answer all the questions. So there you go. Okay, thank you, Dr. Penyaran.
Thank you.
Thank you. To anyone, you're like, I'm gonna kill you, Nicole. But maybe sending some more patients your way. Thank you so much for being on the show.
Thank you. Thank you for having me, Nicole.
Before we adjourn for the day. What's going on with me? Adjourn. Anyone you'd like to say hello to?
Well, to the people of Makati Medical Center, to the doctors, the staff, and nurses, have a wonderful evening.
Okay. Thank you also to the doctors, the staff, and the nurses. You're always very helpful, and don't worry. People like me we appreciate you. We don't underestimate you or take you for granted. Thank you, doctor. Thank you so much.
Good night. Happy birthday to your dad.
Tune in again to Talking with Makati Med. I'm your host, Nicole Jacinto. You've been listening to Dr. Miguel Eladio Peñaranda, and happy birthday again, Daddy. Okay, bye, folks. See you next week.
Bye.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.